What do we need more, bone or soft tissue around our implants? The take-home message was when we need bone and how much bone we need. Basically, we tend to reduce the GBR procedure. So by placing, by having a good implant system, placing the implant a little bit deeper. So I'm Stavros Pelekanos, coming from Athens, Greece. So my main field is implantology and aesthetics. So I studied in Freiburg in Germany. I did perio and pros. And I'm very happy to be here in Dental World in Budapest, which is like huge. I didn't expect to see such a big exhibition. I was really impressed. And I really enjoyed it. My lecture was basically on timing of implant placement in the aesthetic zone. So we introduced some small tips and tricks when we do type 1, type 2, type 3 implant placement or type 4, minimal invasive. So most of my lecture was cases with missing buccal bone, so not type 1. And then we explained some situations, what we do when we don't have the buccal bone in front of the tooth that needs to be replaced. So basically we talked about type 3 and type 4 implant placement. And I gave some tips and hints about how to do everything like minimal invasive without raising big flaps. And we introduced also the new concept of the punch graft technique, which we developed together with Egon Oive and my friend Venci Stankov from Bulgaria. So that was my lecture mainly. Yeah, take-home message is that what do we need more, bone or soft tissue around our implants? The take-home message was when we need bone and how much bone we need. Basically, we tend to reduce the GBR procedure. So by placing, by having a good implant system, placing the implant a little bit deeper and using a one-time abutment are ways to escape or decrease the number of GBR you need in the aesthetic zone. As I really see, it's huge. Every company is here. I didn't really expect such a huge exhibition. Really amazing. Yeah, first of all, the lineup of the speakers is really amazing. The invited speakers and the names are really good. Second, what I like is that I had 1 hour and a half for the lecture, which I think it's a good time for the lecturer and the clinician to give some tips and tricks and to give something more, because when you are having like 20 or half an hour lecture, you don't have the time to see. Plus that every product and every thing that you are showing to the cases, the people, the participants can go out and check it. Since this is my first time in the dental world, I really recommend you to follow the next year Dental World 2025.